Provisional data from CDC's National Center for Health Statistics indicate there were an estimated 107,622 drug overdose deaths in the United States during 2021, an increase of nearly 15% from the 93,655 deaths estimated in 2020. Too many lives are lost because people do not know what is in the drugs they are taking. For instance, according to the New York Times, in December of 2021, a man died after collapsing in a bathroom at a Safeway market in Roseville, California. He bought the drugs on Snapchat. He thought he was purchasing prescription Percocet. It turned out to be spiked with a lethal amount of fentanyl. Other evidence shows that people can die needlessly because people do not know what is in the drugs they are buying. According to a public safety alert from the DEA in September of 2021, Ann Milgram, administrator, said the United States is facing an unprecedented crisis of overdose deaths fueled by illegally manufactured fentanyl and methamphetamine. Counterfeit pills that contain these dangerous and extremely addictive drugs are more lethal and more accessible than ever before. In fact, DEA lab analysis revealed that 2 out of every 5 fake pills with fentanyl contain a potentially lethal dose. According to NPR, a study found that fentanyl-related deaths increased from 253 in 2019 to 680 the following year. And in 2021, 77% of all teen overdose deaths involved fentanyl. What does this have to do with us? In 2018, 45% of college students used an illicit drug. You or your friends do not know what is in these drugs if purchased on the street or on social media. This could potentially lead to an overdose for you or your friends. My recommendation to you or your friends is to carry naloxone, a medicine that rapidly reverses an overdose in case of someone having an overdose. I suggest that you get naloxone from a New Path in San Diego County. A New Path offers free naloxone and free naloxone training to anyone in San Diego County. People who carry naloxone save lives. In summer of 2021, I was working at my serving job on a closing shift. A coworker was experiencing an overdose in the bathroom stall. My supervisor, trained as an EMT, dragged my coworker out and began CPR. Remembering we carried naloxone in the office, I ran to get it. We administered the naloxone and saved my coworker's life. Nearly 27,000 lives have been saved as a result of naloxone kits given to friends and family to reverse opioid overdoses, found a new study published in the Centers for Disease Control and Prevention's June 19th Morbidity and Mortality Weekly Report. Let's summarize. People have lost their lives because they have had overdoses and others around them did not have the tools on hand to reverse the overdose. I want to hand out some naloxone to you now with some information on how to administer it from a New Path that includes resources for training and hopes that you receive training if you have time and share this information with others. In closing, I would like everyone to think about a time where you or people around you were partaking in drugs and think about your friends or family. What if one of them or even a stranger has an overdose and you are the only one around to help them?